At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Arthritic Pain on Wednesday, April 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. You're listening obviously to Dr. Tom Roselle Live, and we're going to have a great program for you today and try to expand upon the topic we've been exploring for the last few weeks, all the joint spaces. But first I want to take the opportunity and wish all of you a very happy and blessed Easter. It's a very important day to all of us, and particularly those of you of the Christian faith. We have to remember our roots, if you will, and take a moment, and hopefully you gathered with family and maybe you went to your churches, but happy Easter to you. And we're now coming into the midst of other celebrations as well, and Passover and the like. So we will talk about those as we go through. But having said that, let's get into the program and begin to touch upon the problem of pain that way too many doctors unfortunately say, well, it happens to be arthritis, and they don't have a lot of evidence to say that it is an arthritic condition. And what do I mean by that? Well, if they can't diagnose it properly, then they say, well, it happens to be that. Or if they run one inflammatory marker and they say, well, because it's inflamed, your joints are probably suffering the consequences. It probably has an appropriate situation relative to diagnostics, and it's necessary to run the right tests, but also imaging and the like. But it's also very important to find out what the triggers are and why it's a problem. We've gone a little bit and we've talked about the problem with, if you will, arthritis and dietary patterns and trauma. But there's an area that I want to talk about that a lot of people don't even think about. And what we're talking about is your dentitia, your teeth. We know that bacteria formation in the teeth can cause heart problems, but bacteria in the teeth can cause inflammatory reactions anywhere in the body, but very importantly in the joints. Interesting, isn't it? So when you have bad mouth, if you will, bad dentitia, when you have loss of bone in the mouth, is one of the primary indicators that you may have a problem that goes far deeper than that situation. Now, here's what I want you to understand. If you have bad bacterium in your intestinal tract, it's going to affect your mouth. If you have bacterial problems in your mouth, it's going to affect other parts of your body, including the joint spaces. Now, if you get into the literature, you're going to find that they start finger pointing that there may be an association between rheumatoid arthritis and oral health, and that's very true. But there's a very definite linkage between problems with the mouth and other forms of arthritis as well. And I'm going to lay out several things, and then we're going to touch upon heavy metal problems that accumulate in the body because of those old dental fillings. Remember the silver fillings that we had in our system? Those can cause joint spaces to break down and degenerate and so forth. So what I want you to really understand is that often health starts in the mouth. And how many times have you gone to your own doctor and you've complained that you hurt, and they actually said, open your mouth and let me look at your mouth? I would guess very few times the mouth gives evidence to other things that are going on. Now, the other situation that needs to be asked is, can arthritis affect your teeth? So let's look at that. Remember I said a few minutes ago that rheumatoid arthritis is associated often with intestinal tract problems, and that they go back and forth. Now, rheumatoid, as we know, can be hugely degenerative, but wouldn't it be great to be able to identify it, to be able to stop it before it began to advance at a level that, maybe totally at that point, completely irreversible? Well, gum disease, periodontitis is what we call it. We know that it's associated with rheumatoid, and people who have bad mouth have about 8 to 10 times more likelihood of having rheumatoid arthritis. Now, the risk increase isn't due to generally oral hygiene. You can brush your teeth, you can floss your teeth, you can do all of those things. You can use a water pick, you can wash out your mouth, and so forth and so on. But the inflammatory elements, these active antibodies, these proteins, if you will, that are found in infected gums are similar and correlate to what's found in joint spaces in many rheumatoid patients. But now I want you to take another step forward. Remember I said gut, mouth, mouth, gut. They're the same bad guys that are also found in the intestinal tract, and they are causing these problems. Now, here's the next step. Did you know that these proteins, these antibodies, these bacterial elements now go into the joint spaces? So now you have joints that are not moving properly. They haven't broken down quite yet, but they're going to get there. And they begin to cause degeneration. Now, tooth decay, that ultimately comes with these little holes. They're called cavities, but then we can take it further and we can talk about something called cavitations, and that goes into the bone. Did you know that even if you've had a tooth pulled because it was infected, and you put a post in or you did whatever you did, that decay can still be in the bone itself? And so subsequently what happens is it begins to get into the circulatory pattern, but also leak into the organ systems. And now you have more problems as well. There's an interesting study that I read quite recently, and it said that mouth ulcers, those ulcerations that can be viral, like herpetic infections of the mouth, cold sores in other words, that they often are associated with ankylosing spondylitis. And many of you say, well, what is ankylosing spondylitis? Well, that's when your spine fuses. That's when the joint spaces don't work anymore. And it can happen to most joints, but it happens to the spine very rapidly. It's a type of inflammatory reaction that many say are due to the specific types of bacterium. And it's often associated with people who are more prone to these mouth sores. But again, are we talking about bacteria? In my opinion, we may be talking about viral elements as well on top of that. And there's a lot of evidence at this point that says that's true. Your teeth start getting loose, they start shifting. Rheumatoid arthritis can lead to gum disease and infections, and they can cause your teeth to become hypermobile and begin to shift and begin to turn because your bone matrix, your jaw bones, the lower portion is called the mandible, the upper portion is called the maxilla, begin to shrink because you lose bone mass, you're losing calcium. And so, what we know today with research is that people that have good levels of calcium intake in their body, and I don't mean just go out and grab yourself a bottle of calcium because that's not the key, but they take it in addition with vitamin D, and there's other minerals as well, have less of a chance, if you will, to have these oral inflammatory infectious processes that build up, which cause this vicious cycle of intestinal tract immunological suppression, and you're losing your teeth and your joint spaces are locking up and so forth and so on. It's really interesting when you take the time to look and see what's out there, because there's more information than what's being told. You're just not being told the truth, or I don't know, maybe these new drugs that the drug companies are putting out there are underlying it. But that's just me talking, and I wouldn't necessarily take a lot of credence in that. But I'm a suspicious sort of guy, and nevertheless. So let's talk about arthritis and what we can do about these problems. Well, in our practice, we're going to look at an arthritic problem from several different vantage points. And what do I mean by that? Well, we're going to look at it from, first, the inflammatory reaction that's there. And remember, we talked about arthritis versus arthrosis. Arthritis is inflammation. Arthrosis is the breakdown of the joint space itself. So we want to see what you're consuming. Are you eating a whole bunch of junk? Are you eating foods that are way high in omega-6, let alone omega-9s? Are we, eating and drinking things that increase the acid level in your body? So then you're going to pull out calcium, making things a whole lot worse. Why calcium? Calcium is alkalizing. And if you have inflammation, that's acidic, or putting things in that are acidic: sugars, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, and the GMO products and modifications. Now, if you're doing those kind of things, you're increasing your risk of all kinds of problems, but particularly arthritic bone-on-bone problems. There's a guy that I like to read, back in the day. He's one of the first people that started finger pointing towards arthritic inflammatory reactions. And that was a guy by the name of Wheel. And Dr. Wheel, many of you know, was the first to, really understand the relationship between pain in the body and inflammatory reactions. And he really began to say, look, you guys get what you get because you're doing what you're doing. There's a center called the Andrew Wheel Center for Integrative Medicine, which I like to click into periodically just to see what they're looking at and so forth. Then they're looking at toxin levels and so forth. Interesting studies lately that they're really focusing on things like rheumatoid arthritis and multiple sclerosis and type 1 diabetes. And because we know all of these things have some kind of immunological impact and inflammatory reactions. Now, in other finger pointing, there's a relationship between many of these things. They all have a microbial triggering mechanism. We're seeing MS, multiple sclerosis, as well, by the way, now today with Parkinson's problems and other neurodegenerative diseases that are lining themselves to these rheumatological suppressive immune problems. And so when you're treating an arthritic condition, you have to take into consideration, as we do, the immune system, the gut, the intestinal system, if you will, fight-flight reactions, the adrenal system. We have to take a look at what the nervous system is able to do or not do, and that means brain, spinal cord, the 31 pairs of nerves that go different places. They hook up to muscles, they hook up to nerves, they hook up to, the areas that are responsible for dampening, if you will, and I use that term, dampening, immunological inflammatory overreaction. So if we know those things exist, then why aren't we looking at it that way? Why are we not looking at the triggering mechanisms, the cause, instead of using more and more immune suppressive drugs? Now, let me tell you why we're using immune suppressive drugs. Number one is it quickly, in most people, decreases the pain pattern by dampening the body's ability to respond to whatever it is underneath that. What are we talking about in this case? We're talking about inflammation. So if you suppress the body's ability to react, if you will, in case of these conditions, we're talking overreacting, and but it doesn't fix anything. It actually suppresses the body from being able to handle other things. And so if you listen to the online television commercials, right, and television commercials, they're talking about take this and within so much time, you should see a difference. But you also have the side effects, including blah, 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 and death. Well, all of them do that. So my thought process, call me silly, is that why would you take a drug that can cause you to die or shut down other pieces of your nervous system when there's other ways of making it happen? Now, we talked about structural problems, right? We talked about, if your spine's out of position, if your body's not balanced properly. We talked about nerves that are being pinched, and all of those target different immunological pathways in the body. Now, could that be the underlying situation that is causing this chronic inflammatory reaction, this culprit, if you will, that causes the disease process? It could very well be. And so you have to look at that. You have to make sure you take that in consideration. Could stress patterns, and I'm going to share something with you today, and I want you to, when we're done here, make sure you follow me on my live stream program. All you have to do is go to drtomroselle.com and click in. I'm going to talk a lot more about the emotional pathways today. I'm going to talk about, what this arthritic condition really is all about. And I'm going to give you some things that you can do. So go to drtomroselle.com. But also, more importantly, before I forget, on April the 10th, we're going to do an evening at the Roselle Center for Healing in Fairfax on arthritic and degenerative conditions, but more importantly, what you can do about them. And my co-presenter will be Dr. Harlan Browning, who we affectionately call the professor because he's so capable of taking things that are complicated and bringing them down into a very understandable platform. So please join us. I think you're going to be very surprised that a lot of this is reversible, even when your doctor says, well, you're really headed for a hip replacement. You really know that you're going to have that knee done at some point, or that shoulder, there's really no way of resolving that. Well, there's too many people out there at this point that would go into deference with that and tell you that, in fact, there actually is a lot of different ways of reversing that. What's that we're going to cover on the 10th? So join us. You need to register for that class. So you can go to rosellecare.com. That's ROSELLECARE.com, or go to drtomroselle.com. And by the way, that's how you go to the live cast today, is you go to drtomroselle.com and the screen will pop up. Click that and it'll take you right in. Or if you follow me, which I hope you do, on any of your social media sites, it doesn't make any difference whether it's YouTube or Facebook or Instagram or Rumble or any of those, follow me and we'll let you know anytime that we do a live anything. And we're going to try to continue to give you as much information and data as we possibly can. But if you knew there was a way of reversing this stuff, if you knew there was a way of changing things around and get your life back, wouldn't it be worth doing that? Or are you one of these people that really want to do just drugs? You really don't care if the rest of your immune system is beat up, and you really don't care if, you go into autoimmune other things as well. Well, if that's the case, then I can't help you. But if you really have an interest in reversing things, then guess what? You can make a big difference. Now, when I get into live stream today, I'm going to talk quite a bit about what happens when you have an emotional platform of rigidity. Listen to what I said. When you have an emotional platform of rigidity, what does that mean? That means that don't confuse you with the facts, because you're not going to shift your opinion. Your body also then goes into agreement with you, and you begin to express itself in tightness throughout your entire system. See, the structural neurological platforms, the biochemical, bioelectrical platforms, and the mental state, the decisions, who you are, how you are, and so forth, that you have decided that's your identity, all go hand in hand together. And we're going to talk about that. So maybe that arthritic condition that you have that started up that way, now it's affecting everything in your body, is a result of your decision-making process. Means that you've decided that your way is the right way and there's no other way, and you're not going to be influenced by anything. You're stuck. You're rigid. You're not willing to accept anything else but that. And what happens is you internalize all of that. And when you internalize all of that, you begin to become what? Angry. And you begin to have inflammatory reactions, and you gnash your teeth, and your immune system gets its butt kicked. So there's a lot of things that can come about just because we make decisions that aren't necessarily appropriate relative to, oh, well, it is what it is type of thing. So you're locked in. And that's another part of the puzzle. So we're going to talk about things that you can do about this on the 10th. Please join us. We're going to talk about this chronic inflammatory reaction, as they call it, as far as red, swollen joints, or difficult moving at all, or suddenly can't lift anything up. And we're going to distinguish them based on what is really taking place. Is it an arthritic condition, or is it a muscle that is not working, or a group of muscles that aren't working the way they're supposed to? Now, if you don't get those muscles to work properly, let me tell you something, you will break down your body. Now, if you go down and you really go into Touch Research Institute, and that comes out of the University of Miami Miller School of Medicine, they talked about what happens when your serotonin level, your feel-good juice, your relaxation juice is diminished as it relates to this type of problem that we're talking about. Kind of interesting, right? Got my attention. So here's the deal. We're going to get into this very much in depth within a very short period of time, called my live stream. Join me at drtomroselle.com. Join me on the 10th here at the office, and we'll make sure that you get all the tools that you can to reverse things. We're coming up to, I got to meet you on the other side on the live stream. And remember, I do this every week simply for one reason and one reason only. You guys need to know the truth about everything that happens to you, but more importantly, I do it from my heart. I love you all. Have a great day. We'll talk to you next week with much more. Remember the 10th, go on RoselleCare.com and make sure that you sign up, because we only have so much space at the office. And I don't want you sitting out the hallway, which sometimes you have to do because we're that busy and that many people need information. I'll see you in a couple of seconds.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Arthritic Pain on Wednesday, April 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.